Okay, so I'd like to start by acknowledging that a lot of this work was done on the traditional lands of the Ngunnawal and Ngambri people, and I'd like to pay my respects to their elders past and present, and to any First Nations people who are joining us here today. And also, I've been considering who the traditional custodians of the land in Scotland are, and maybe people can talk to me about that later. But anyway, I pay my deepest respects to all of you. So the topic of my talk is really about capturing the harms of tobacco and also considering tobacco control, but also thinking about ensuring perspective, because one of the biggest tactics of the tobacco industry is to really avoid perspective, is to distort and to delay and to deceive. So we have to be incredibly vigilant about those things in terms of ensuring progress. So I'm going to talk about just a little bit about the tobacco industry model. I notice we've got some fantastic colleagues from Bath online, so I'm not even going to begin to scratch the surface on that. I'm going to talk a little bit about tobacco impacts and tobacco control in the Australian context, and particularly talking about recent reforms, because one of the things that the tobacco industry has been doing is painting a picture of other places as a kind of hellscape where things aren't working, because the one thing the tobacco industry doesn't want is a great example of what works. And then I'm going to talk a bit about how we're monitoring what's happening with the recent reforms and some of the latest evidence on health effects, which is work from specific work from my team, and then some concluding thoughts on the importance of evidence and perspective. We are leaving quite a lot of time for questions and discussion. That's the idea of having all of you here and having me here rather than a recording. So as you know, the tobacco industry is the sole cause of the tobacco epidemic, and its model, broadly speaking, is that they have an extremely addictive and appealing product that they work to make even more addictive and even more appealing. They get people addicted as children and adolescents because that's when the brain is plastic and when people are most likely to become lifelong customers. So a lot of the very wide range of tactics they use, there's a whole taxonomy of it, but some of the things they do to protect their interests are to normalise tobacco and tobacco use, to oppose regulation, to blame users. And it's very important to remember that this is a highly addictive product. As soon as something is addictive, you remove choice effectively. One of the main things they do is to try and control the narrative, and they have massive resources to do this. So we've been seeing in Australia, and I know that some of the Australian stuff has been, things about the Australian measures have been coming here because the industry is working very, very hard to control the narrative. So it's hard work opposing that because of the resources and the third parties they act through. They obviously do not want examples of successful tobacco control to get out there. They got very burnt by plain packaging. And if you think about the resources that Australia had to invest to defend plain packaging, which is now used by more than 26 countries worldwide, you can see why they want to avoid any examples of success. They're also constantly innovating and using a lot of new products or varying their old products. And so any tobacco control has to also innovate to keep pace. They are known to exploit illicit trade in tobacco. And that is something that everybody faces. Every country that's doing tobacco control faces issues with illicit trade. So I've got a little picture there of a monster. There are monstrous aspects to the tobacco industry. So let's talk then about the tobacco impacts. Tobacco is responsible for around 8 million deaths annually, and that's more than 10% of deaths worldwide. So it's a terrific party trick to say, how many deaths are there in the world every year, or, how many deaths are in Scotland, how many deaths are in Australia. It's good to have ballpark figures on those. It's 60 to 70 million deaths a year in the world, depending on how into a pandemic you are. But more than 10% of those are from tobacco. In Scotland, it's of the order of 9,000 deaths, and that's actually 20% of deaths in Scotland are attributable to tobacco, and it's more than 20 deaths a day. But I'm thinking, so in this picture, I think you'll see my grandmother there. She had such bad emphysema. She was breathless putting on a shirt, having smoked gaspers since being a very liberated woman in the earlier part of the 20th century. I think you can see I'm next to her there, and we have exactly the same body position. And I would just say that she was a kind of kindred spirit to me, but she was very affected by her smoking. There's also my dear friend Anne-Marie, who left behind her 3 teenage sons when she died of lung cancer. And that picture there is Patrick, my first boyfriend. When I was at school, I used to hold hands with him when I was 13. He died a few years ago of lung cancer in his early 50s. So that's my story. But that's because the numbers are so large, every family is affected. There are empty places at the Christmas dinner. There are children without grandparents. Every family is affected. So it's really important that we remember these are not just statistics. They are, they're people and families. And obviously the sole cause of this is the tobacco industry. If the tobacco industry didn't exist, we wouldn't be facing this. So what works for tobacco control? So people say, what should we do? What is the thing we should do? They often ask me. And first of all, I say, well, I'm an epidemiologist and public health physician. My main emphasis is providing evidence for policymakers and advocates. I try to steer clear of saying exactly what governments should and shouldn't do, but I say that certain measures are consistent with the evidence. The thing to say about when people say, what should we do? Should it be plain packaging? Should it be education? Should it be other things? I would say the whole point is it's not any one thing. And that's why we need to make sure we have comprehensive measures against tobacco, because we are up against such a terrible opponent, and that those measures need to keep pace. So that's where the WHO Framework Convention on Tobacco Control comes in. I know all of you would be aware of this, and the Empower measures really sum up the taxes, the bans on advertising, the mass media campaigns, the support to quit, smoke-free spaces, and the monitoring. What we do know is that we have increasing, although very incomplete implementation of the Framework Convention, and we've seen huge reductions in global prevalence, which have had major benefits to health and millions of lives saved. And I think what is really worth thinking about is, what is the counterfactual? Like, what would it look like if we'd had no tobacco control? And if you consider that, at least in Australia, and I'm sure it's common in other places, earlier part of the 20th century, 75% of adult men smoked. So if we had kept going at that level without tobacco control, without awareness of the harms, we would be we would have a very even worse situation. But there are continuing gaps. And this is where the industry is always seeking to innovate and to evade and to regulation and to oppose us. So and if we think about the industry pushback, part of the major reason why the industry pushes back on tobacco control is because it works. If we were doing something that didn't work, they'd leave us to it. So there's a thing known as the scream test, which is the better you're doing, the more the industry will scream. So that pushback is very diverse, and often it's quite hard to detect. What the community sees is media articles about fire bombings due to illicit trade, or media articles calling tobacco policy people stupid, or I get trolled online. People put dollar signs on my eyes and say I'm just there for the money. If they can tell me where it is, I'd love to know. So there's a huge range. But one of the things that I keep hearing is people saying to me, I hear the tobacco control measures in Australia are draconian. I hear you're in a hellscape. So I have people saying to me, basically misinformation, that is. So I can assure you that Australia is not a hellscape. I haven't put any pictures of how beautiful it is and what the life is like there, but I think you would all know that it's not a hellscape. But it's this labelling of regulation as radical and extreme. The interesting thing is the scream is louder for more effective measures. So they really scream about price, really scream about bans on advertising, really scream about smoke-free spaces, and the plain packaging screams were very loud. Measures to limit supply. And the other thing is the measures to avoid political interference are very loud. There's loud screaming when you say political parties should not be allowed to consistent with the treaty we have signed, political parties should not be allowed to accept donations from the tobacco industry. Interestingly, there are some things that industry doesn't seem to mind. So decades ago, I had a conversation with Sir Richard Doll, and he mentioned in the 1950s, when their findings were coming out, that a tobacco industry executive had said to him, well, the main thing we have to make sure is that the young people don't do it. So we should tell them not to do it. And Sir Richard Doll said, so I knew that would be the least effective thing to do. So obviously education matters, but it on alone, without all the other things being used, it is not particularly effective. And then individual cessation measures with medication, very important as part of comprehensive tobacco control, but it's in terms of the scale of what happens, it's not seen as particularly threatening by industry. Oh, by the way, my name is now Dirks. That's another one. I mean, I can just tell you that, you know, so one of the things that with colleagues in Bath, and I noticed Britta's online here, is that we're working to help support people who work in tobacco control to really deal positively and to gain energy and motivation from and to be able to cope with some of the industry pushback. It varies enormously by context. So for me, I work in an organisation that can support me with legal support and can actually help with security and things like that. In many places, the pushback from the industry can be life-threatening. So I think we have to remember that we're really talking about a very wide range of contexts, and industry pushback, you know, making the most of whatever's possible within that context. So the Australian context, how's it going? So we do have the comprehensive measures. We are signatory to the World Framework Convention on Tobacco Control, and we've been working very hard on all different fronts. We have extremely high prices for tobacco, among the highest in the world. And we also have bans on advertising. It's really normal to have smoke-free spaces. I get quite surprised when I'm in places where people start smoking, even outdoors in cafes. We are a federation. We have complex interplay between state and federal legislation. But working together, we've got a range of more kind of federal level reforms. So we had a number of different tobacco control legislative measures that were due to sunset. So we're all kind of panicking that we needed new legislation that brought those all together, but also brought them up to date. So our advertising bans legislation actually predated the social media, things like that. They needed bringing up to date. So the recent tobacco reforms, which have been over the last couple of years, have brought together those previous acts. They've done updates, particularly regarding advertising. They've provided a greater ability to standardise and regulate products, because the industry was manipulating the amount of tobacco and the size of the products in order to make things look cheaper. There's also a lot more obligations on industry to report sales and to report other things. And then there's also been reforms related to electronic cigarettes and other emerging measures. So this is a First Nations information sheet on the side to say what's happened to my smokes, and it's saying they'll taste and feel different. There's no menthol allowed anymore. There's also other flavourings are banned, that every cigarette is going to be the same size and shape. There's actually a ban on using words that convey deceptive health measures. So smooth is not allowed anymore, and gold is not allowed anymore. They're going to be consistent in size, and there's going to be new health information. So there's more kind of information there, but you can see on the right there is a health. These very heavily tested health inserts that go inside the cigarette packets. So good things happen when you start smoking. And on the back is the quitline. And then this is a photograph from one of my colleagues. Our team did some of the evidence reviews about dissuasive measures on individual cigarettes. So one of the things that's happening now is that on the filter on each cigarette, it actually has a health warning. And so this was called, tobacco control in the wild. For the first time, we saw in the gutter a butt with a message on it. And Canada we're the second country to do that. So how are we going? Well, a lot of these measures have just come in, so we don't have specific tobacco smoking prevalence data to share with you about what's happened since those measures. In fact, some of them really, it was like the 1st of July, some of them are coming in, and some of them have, so only over the last few months. What I can say is that we have national targets of 5% or less daily adult smoking and 27% or less for First Nations people. Some of the projections show that we are not going to hit those targets, unfortunately, without accelerated action. So we're hoping that some of these new measures may help us to get closer to that. I can say that the latest data from 22-23 show that we have 8.3% current daily smoking in people aged 14 and over. And that we're seeing particularly low prevalence of smoking among young people. But we do note that it's one thing to have a target for the whole population, to say we're going to be going towards tobacco elimination, but if you really do have to look at inequity in that and make sure that your targets relate to not only the whole population, but how you're going within it. So you can see our kind of graph there about all the different measures that have been brought in, and that prevalence of adult daily smoking and key messages. So key measures. So one of the things that is really powerful in terms of driving down smoking is price. The World Bank has shown that for every 10% increase in tobacco price, you get a 4% decrease in consumption, depending on the measure that you use. So this is just a graph to show, with the blue in it is the prevalence of at least weekly smoking. So that's gone down to 9.4%, and you can see going down there. And then what we've got, some people have said, oh, this drop in smoking is due to increasing in vaping. And we just want to show the broader things that have been going on. What we can see, so the green line at the bottom is the prevalence of at least weekly vaping, which has gone up to 4.8% down in the bottom. But what you can also see is the orange line, which is the tobacco prices expressed as an index. And that has really, really increased radically. And the other thing is that the wage index, so we've had a cost of living crisis like many other places, so the affordability of tobacco has become much lower. Now, what we have got, so I wanted to just give you some information that you would all be aware of from the Scottish Health Survey, to just look at the progress in Scotland. And I think I've been informed that the 2021 figures are a little difficult to interpret because of the measures that happen in data collection because of COVID. So it's probably better to kind of just think of it connecting up the previous line to the 2022 figures. So there's 15% current smoking in adults aged 16 and over, noting that that also includes occasional smoking. So it's not current adult daily smoking. But I think what we see is that probably the smoking prevalence in Scotland is of the order of a third higher, 30% higher than what we see in Australia. So when people say that the Australian model has failed, I think it's very important to look at the data. It's very important to be evidence-based about that. So obviously there's been incredible progress in Scotland over time, from 2003, where there was around 30% of adults currently smoking. So, having halved since then. And I think, but I think it's very important to make sure that whatever you're doing, you're trying to compare like with like. If we also look in young people, which I think a very important thing, because that's really about what carries through, we're talking about those cohort effects that carry through. The top panel is the Australian National Drug Strategy Household Survey from 2022-23. And what we've got there is daily smoking, weekly smoking, and then what we call regular smoking in those age groups. And what you can see is it's actually lower in the 18 to 24-year-old group, which is really positive. And also daily smoking is down to 6% in that group. And I think what is interesting is looking at the Scottish Health Survey data. There isn't quite that low smoking among young people, which is another, I think, source of something that needs attention and care, because what we find in Australia is the drop in prevalence overall is increasingly driven by young people not taking it up. The time was when that drop in prevalence was really heavily driven by adult smokers quitting, and that's still extremely important. But as the prevalence goes down, it's increasingly driven by young people not taking it up. So these are the data from school children in Australia too, and we've got all the different measures of smoking there. This is a very large large study based in schools. And we can see there that for this 12 to 17-year-olds, we've got about 2% having smoked in the past week, 3.4% smoked in the last month, and 8% smoked in the last year. And from the Health and Wellbeing Census, it's actually S2 and S4 I've worked out. I thought I find that I was trying to come to terms with the different structures of the surveys. So younger age group is 2.7% regular smoking, and the ASH Great Britain data that was specific to Scotland, it was about 4.4% current smoking. So reasonably low prevalences in school children. So in terms of some of our challenges, one of the issues we have is that if you add together vaping and smoking, the overall nicotine use and nicotine addiction in children in Australia and many other countries is increasing. So, and we also have some warning signs regarding smoking susceptibility. So this is a question that is asked of school children about, how likely do you think you'll be smoking in the future, or, the kind of questions that speak to a vulnerability to take up smoking. And we've seen that start to go up. So there's a lot of concern about that. The other issue we do have is illicit trade. So we are seeing sudden increases in illicit trade to the point where it's about, in the latest data that we have from a tax office, it's about 18% of the tobacco sold in Australia is illicit, but it's becoming much more common. And that's really undermining, particularly for youth, because suddenly it's more affordable, but also because it's illicit, people are often selling single cigarettes and making it more accessible to children. And then the problem too of enforcement. We do actually have laws against illicit trade, but really part of the issue is making it a priority for policing and for other staff, and it can be a very threatening environment for public health staff if there's organised crime involved. So if I now go into just some of our latest data, this is sharing some data from just to give you some background of, even though we're making great progress, tobacco use is still our top risk factor for fatal burden of disease. But these data from our Australian burden of disease study were based on relative risks from international data. So we know that smoking impacts vary between populations, and we know that those estimates from international estimates may well underestimate the impacts in terms of relative risks in Australia. So we wanted to feed into direct Australian evidence on the relationship of smoking to cause-specific mortality, that is death from different causes, and also to really refresh and update our data on the number and proportions of deaths attributed to smoking. So we used a large-scale study from an organisation called the Sachs Institute, which is the 45 and up study, and we followed up through data linkage for 28 causes of death. So we ended up with about 180,000 participants after exclusions, and there were around 13,600 deaths in those, and a median of 9.3 years of follow-up. So we found that people who were current smokers were around 3 times as likely to die during the follow-up period, and they had a significant increased risk of dying from 23 common causes. So we ended up doing a kind of media release with every single body part related organisation you can imagine, because there was something for everybody. When we released these data, we were working with the Cancer Council, the Heart Foundation, Dementia Australia, the Lung Foundation, and multiple other public health associations. But you can see here the big ticket items: a 36-fold increase in the risk of dying from chronic lung disease, an 18-fold increase in the risk of dying from lung cancer, and oropharyngeal cancer increases, coronary heart disease, stroke. We also found a 60% increase in the risk of dying from dementia, which hadn't been shown before. We also found that the risks were increased with greater smoking intensity, but even what we would call lower intensity smoking carried very large risks. So when I was talking to my friends at a party about the findings before they came out, I've got a friend who smokes 1 or 2 cigarettes a day, and I said, "Morgan, I've got some bad news." And she was like, "Oh no, but I was sure it wasn't that bad." But particularly because you're going directly onto your lungs, the risks of chronic lung disease and lung cancer are appreciably increased by quite low intensity smoking. So with that group, which is 1 to 14 cigarettes a day, which is a mean of about 10, that's a 20-fold increase in the risk of dying from chronic lung disease and a 13-fold increased risk of dying from lung cancer. But even if we look at that 1 to 5 cigarettes a day, it's a 9-fold increase in risk of lung cancer deaths. Quitting smoking at any age is beneficial. The earlier, the better. So if we then look at taking those relative risks and applying them to population data from Australia to say, well, what would that translate into number of deaths? It's a total of over 24,000 deaths at ages 45 and over. So that means it's at least 24,000 deaths because we haven't counted those younger deaths, although they are quite uncommon. For us in Australia, it's 66 deaths per day, and that's 66 deaths per too many. It's 1 in 6 deaths. So it's, Scotland is estimating it's 20%. We've got a bit less than that. The other thing is that smoking leads to dying prematurely. So I hear people say, well, I'm going to die of something sometime. But what it does lead to is a 10-year on average loss of life. And actually, it's responsible for nearly 1/4 of what we would call premature deaths. That's deaths from between the age of 45 to 75. It is higher than previous estimates, but we do have previous data showing in the Australian context that tobacco smoking has societal costs of $137 billion per year. So, perspective and implications. As I've said, it's every family. In Australia, the annual road toll is about 1,200. So I don't want to do an arms race and say, well, look, this is 20 times the road toll, but we care about the road toll. We shouldn't be normalising smoking deaths. We know that the tobacco industry's modus operandi is to maximise consumption and price and to maximise their profits, and this is the cost to society. So I just wanted to have a note about illicit trade because I know that people there's been publicity saying that Australia's got all these fire bombings and illicit trade's out of control and all that sort of thing. I can just tell you the latest estimates from the HMRC is that 16% of the market in the UK is illicit. But in addition to that, you have cross-border trade, which is not illicit, but it's not paid the same duty. So, and that's actually quite substantial as well. In Australia, our most recent estimates are 18%, but what we have is a massive media campaign, what appears to be a massive media campaign to really publicise that. What we know is that illicit trade is a very important part of tobacco control. And we also know that the tobacco industry will work to use it and weaponise it as part of its distraction, its distortion. But the other thing that they have been doing is to create a false dichotomy that it's tobacco control or control of illicit trade. You can't have both. So, this is just some examples of what's on the news. And when I say I work in tobacco control in Australia, people go, oh, gosh, we've seen all those fire bombings. And people have a lot of difficulty believing that the vast bulk of the market is still legal in Australia. It's still legally traded cigarettes, used according to the manufacturer's instructions, deadly. So what they want us to believe is that all of our positive measures like increasing price, smoke-free spaces, advertising bans are trying to get that smoking prevalence down, and control of illicit trade would be in opposition. And in fact, one of the major things they're calling for, many third parties and other groups, is to reduce tobacco excise. So if you imagine it's about $50 for a packet of cigarettes in Australia, it's $15 to $20 on the illicit market. If you were to reduce excise to the point where it competed with the illicit market, you'd have to have very, very cheap cigarettes. And we know from other countries such as Canada, which had some quite well documented industry-driven reductions in excise, that consumption goes up if you do that. So we need to make sure that actually we're working on the reality, which is that price and smoke-free spaces, advertising bans, all of those comprehensive measures that we use to control tobacco are, all part of actually reducing prevalence, and controlling illicit trade needs to be in concert with those things. Controlling illicit trade will also reduce prevalence. So we need to make sure that we're all working together and that we have controlling illicit trade as part of it. And enforcement is unfortunately one of the main parts of that. And the UK has been quite successful in reducing, like 16% is what success looks like in many ways, but obviously it should be lower. So in terms of solutions, we really need to make sure that we have clear perspectives on the harms of tobacco, and that we are relying on evidence. But I think we have to be clear that there is competition for the narrative. And one of the things that we working in tobacco control have to do is keep going with that narrative that that tobacco control matters, that tobacco control works, that measures to combat illicit trade need to be part and parcel of controlling tobacco, and that control has to be a priority as well. I do also hear police saying, well, look, I've got domestic violence, got all these really acute problems I've got to deal with. I'm not sure I really want to be going into these shops and busting people. And then you'd say, well, it kills 66 people a day in Australia. It's just slower. And you would have similar statistics. So we need to ensure that there's synergy between tobacco control measures, and we need to make sure that we are really going hard on the World Framework Convention for Tobacco Control Measures. And the Framework Convention includes a provision for innovation in tobacco control, for being bold and for going, going harder. So I'd like to thank you. This is a picture of the hellscape that is Australia. And there we have many smoke-free policies. Thank you very much. I'd like to acknowledge all the people whose work has contributed, particularly my colleague Grace Joshi, and other people in my team. And I'd also like to thank Ash Scotland for the opportunity to speak with you.